Welcome to Thursday's edition of COVID-19. Recent reports by relevant entities show Korea's economic recovery has met an uncertain course amid the Delta variant and rising costs of raw materials. Now, we have more on this later on the program after a look at the COVID-19 updates with our Kwon So-ah. So, welcome.
Hi, Sunny.
Right, so what is the latest here on the local front?
Well, there's hardly any change in today's infection numbers compared to yesterday. 2,049 is the figure that has been tallied until 12 a.m. this Thursday. And with that, for the second consecutive day, domestic transmissions are also standing at above 2,000. With that, Korea has accumulated 267,470 infections with a death toll at 2,343. If we take a look at our graph of the numbers in the last days, we are seeing a revision here yesterday from 2,050 to 2,048. Meanwhile, today's number also represents an on-week increase compared to last Thursday when we were at below 2,000. Now, by region, the capitals Seoul and Gyeonggi-do province are seeing over 600 infections and 108 in Incheon. Meanwhile, here in Chungcheongnam-do province, 152 infections. This is a record high here in this province, the highest figure ever reported since the pandemic broke out here in Korea, and that is attributed to a cluster infection linked to a religious facility. In most other places, double digits, including on Jeju-do Island, where there's been a cluster outbreak linked to an elementary school. And speaking of school outbreaks have been on the rise lately. According to the Education Ministry on Thursday, the average number of daily infections among students between September 2nd to 8th stands at 177, and that is the second highest figure this year. Also, a daily average of 10 school staff members were infected in the same span. Now, despite strict prevention guidelines at schools, there are concerns emerging again as the country has been expanding in-person classes earlier this week. The good news is, though, that the vaccination program for teachers, instructors, senior high school students, as well as others that take their college entrance exam this year will be completed later this week on Saturday. Now, for now, we've got almost 62% of the nation's population that has received at least one dose of COVID-19 vaccine, and 37.2% are fully vaccinated.
Right. Meanwhile, so I hear the WHO has renewed its appeal against booster shots.
That's right, Sunny. So following its earlier call on a moratorium on booster shots until at least the end of September, the World Health Organization has extended that call, saying that people at the highest risk are yet to receive their first dose. And they have been urging for vaccine equity. So let's take a listen.
Today, I'm calling for an extension of the moratorium until at least the end of the year to enable every country to vaccinate at least 40% of its population.
So where they're getting high coverage with these vaccines now, you've seen it, they are still having COVID cases, but their COVID deaths are plummeting. In the countries with the low coverage, they are still having high rates of COVID deaths. And this is what we need to change, and change as rapidly as possible.
Finally, let's take a look at some infection numbers around the world. The U.S., here with 41.39 million infections, has seen more than 250,000 kids infected in the past week. That is the highest ever that the country has seen when it comes to these young people that have been infected. And then all the countries from the U.S. until Turkey here are seeing at least 5-digit figures of daily infections. The same with Iran, Germany, and Mexico, and even the Philippines, which saw over 12,000 cases in the past 24 hours as of noon Korea time. And the total number of infections around the globe stands at 223.3 million. Those are the updates I have for now. I'll see you back after the government briefing. Sunny?
All right, so thank you for that. Right. Pundits say the pandemic has accelerated the adoption of artificial intelligence in the medical arena to better address challenges in curbing COVID-19. For more on this reality, I have our Ji Abili here in the studio with me. Welcome, Ji.
Hello, Sunny. So like you said, social distancing measures across the globe have increased our reliance on tech in every corner of our society. In today's segment, let's begin in Korea's port city of Incheon. The city government launched what it dubs Nugu Vaccine Care Call, an AI program that checks in on residents who received COVID-19 vaccine. The service is provided free of charge by SK Telecom, Korea's largest mobile carrier, as part of its community outreach efforts.
Right, Ji. So how does this service work?
The program will call 3, 7, and 14 days after the inoculation to ask about any unusual symptoms. The AI will compile the responses, which can then be viewed by Incheon healthcare workers who can take follow-up measures as necessary. The AI also provides information on rare but serious vaccine side effects such as thrombosis and heart inflammation. The Incheon government didn't specify the technology behind the new service, but it's likely a form of natural language processing. The goal of NLP is programming computers to process and analyze large amounts of natural language data, which refers to the language that we use. Natural language processing is a subfield of linguistics, computer science, and artificial intelligence.
I see. And Ji, at the moment, in most places, this interaction over the phone is led by actual people.
That's right. So that means telemarketers are losing their jobs. An Oxford University study categorized telemarketing as one of the jobs at high risk of computerization over the next 20 years. The university's academics Michael Osborne and Carl Frey calculated how susceptible to automation a certain job is based on 9 key skills required to perform it, including social perceptiveness, negotiation, persuasion, and more. Other job titles soon to be replaced by robots are accountants, realtors, and pilots.
I see. I suppose we'll have to wait and see before passing judgment on whether that loss is to our benefit then.
It depends on really how we make of it, I guess.
Right.
Yeah.
Meanwhile then, Ji, how are other countries making use of technology to better respond to this pandemic?
So I have a U.S. example in this. So last month, California-based Terasaki Institute for Biomedical Innovation, or TB, announced its researchers developed and validated an image-based detection model for COVID-19. Using AI technology, the model analyzes lung images to detect COVID-19 infection. Medical imaging has always been an important tool in assessing various types of diseases. In recent years, artificial intelligence models have drastically improved the imaging technology's diagnostic capabilities. By incorporating AI into imaging technology, models can reveal disease characteristics that are not visible to the naked eye. TB researchers use a model to automatically collect imaging data from the lung that were then analyzed to identify features as potential diagnostic biomarkers for COVID-19. In the artificial intelligence model, the diagnostic biomarkers were used to differentiate coronavirus patients from pneumonia and healthy individuals. In its press release, the U.S. Research Institute explained a similar model can be applied to diagnose other diseases using different imaging modalities. This study shows AI helped not only boost the accuracy and speed of such diagnosis, but also made it less expensive and non-invasive. Experts say computer modeling with data extracted from medical imaging could revolutionize medical practice in clinics. Another advantage that AI brings to the medical field is being able to capture full sets of information while suppressing irrelevant features more efficiently. That's all from me today. I'll be back same time next week.
All right, Ji, as always, thank you very much for the coverage. Right, it's time now for the regular afternoon briefing on the pandemic situation here in Korea for this Thursday. The social restrictions under levels 4 and 3 have been extended nationwide until the 3rd of October. Among the notable changes are the reality that dining establishments can cater to in-house patrons until 10 in the evening, even under level 4, and that a few more people can gather socially, provided the party includes vaccinated individuals. Under level 4, a total of 6 people can meet for social purposes during the day, if the group includes 2 who are fully inoculated. After 6 p.m., a total of 6 can gather if the party includes 4 who are fully vaccinated. Under level 3, a total of 8 people can socialize if 4 are fully inoculated against COVID-19. Now, meanwhile, during the week of Chuseok holiday, a total of 8 people, 8 family members that is, can come together within a household setting only if 4 are fully inoculated. Let's now take a closer look at some of the measures under level 4. Up to 4 people can mingle until 6 in the evening, and after 6, only 2 people can do so. But should the party again include 2 people who are fully vaccinated, then up to 6 people can gather socially during the day. The briefing is about to start. We'll come back to you afterwards.
First of all, here is Mr. Kim Gi-nam with today's briefing. Let us now begin a regular briefing for September 9th, Thursday. And first of all, on the post-inoculation adverse responses compensation, after the COVID-19 vaccination, we have been seeing the correlation of these side effects and also COVID-19 vaccine. And to this end, we have been providing compensations for medical treatment. And starting from today, we will be expanding the people to also include mild symptoms when they have special symptoms. And as for these special symptoms, those are designated by the WHO, and they include the Guillain-Barré syndrome as well as the heart inflammation and myocarditis and so forth that have been designated by the WHO. And this measure is to also secure our public against the risks of COVID-19, and they will be implemented starting from today, which is September 9th. And we will also be providing the compensation for those who have been inoculated before the implementation date. And up until now, we have only been providing the compensations for those who have received intensive treatment, as well as those people who have been reported with the serious symptoms. However, starting from today, we will be providing these compensations for those people which include the mild symptoms, and these people will be provided with up to 10 million Korean won. And right now, as for the people who are subject to these to these measures, have been a total of 35. And with the expansion of the recipient, we believe that this can benefit more people. And as for these people who are subject to these measures and support, we will also provide the fees for professional care providers, and these going forward will be implemented going forward so that we can also have no loopholes in providing actual support for the people. Moreover, as for the adverse responses that inevitably occur due to COVID-19 vaccination, as for these damages that are designated by the WHO as well as other international bodies, we will be providing immediate support, and we will also closely monitor any of the side effects that are reported here at home and abroad, and we will also expand these compensations to include more people going forward. And as for the analysis results of the compensation team, they have carried out 29 rounds of meeting, and they have looked at the reports of the adverse responses after inoculation. And as for more than 2,000 cases that have been reviewed, we have about 250 cases that have deemed to have correlation with the COVID-19 vaccine, and 34 cases have been decided to have lack of insufficient data. And we have also looked at 51 close cases, and we have looked at 2 dozens of the anaphylaxis cases, and 2 of the severe cases have deemed to have a lack of medical document. And as for several anaphylaxis cases, we see that there has been no correlation with the COVID-19 vaccine. And after analyzing these results, we have been looking at 19 deaths, and we have seen that average age was 79, and all of the 19 people had underlying illnesses, and 6 received AstraZeneca vaccines, 11 received Pfizer vaccines, and Moderna and the cross-inoculation, there were 1 respectively. And as for the 32 severe cases, the average age was 70.5, and about 25 people had underlying illnesses, and it took about an average of 10.9 days after to show such symptoms, and 11 people received AstraZeneca, and also 3 Moderna vaccines, and 1 was cross-inoculation. And as for vaccine supply, we also have Moderna vaccines, about 873,000 doses to arrive in Incheon International Airport today. And as of today, we have a total of more than 64 million doses of the COVID-19 vaccine that have arrived in Korea in a cumulative manner. And going forward, we will also cooperate fully with the vaccine developers internationally. And as for global outbreak of the COVID-19 globally, we are seeing similar cases from the previous week. And in the US and Israel, we are seeing a high proportion of the cases, especially those under the age of 20. And we have seen more than 4.49 million new cases for the past week, which is very similar from the previous week. And the US, compared to July, first week of July, they have seen an increase by 916%, which is a dramatic rise. And we see that most of the cases, a large majority of the cases were children and also teenagers. And as for the UK, they have seen weekly hospitalization rates increasing as well. And also as for people aged over the age of 80, this is even more significantly higher as well. And as for Israel, they have also reached the all-time high infections. And also as for those people under the age of 20, they have accounted for about 43% of the total cases. And globally, the Delta variant is also fueling new infections. And on the other hand, here in South Korea, we have a relatively low daily cases compared to other major countries. And out of every 1 million here in South Korea, we have about 229 new infections, which is a slight drop from the previous week. And this is about 1,300 in France. And also Japan also saw a significant drop slightly. However, this is over 3,000 for the US and UK, and also more than 870 for Germany, and 7,000 that is for Israel. And as for new fatalities, we have seen a slight drop, and about 27 new fatalities were reported in the US out of every 1 million people, and about 21 were reported in Israel as well, which is an increase from the previous week. And here in South Korea, we are only 10 days away from the traditional Chuseok holiday. However, we are yet to see the spread of the virus abating here in the capital area. And if we are not able to contain the virus in the capital area, we believe that we have higher risks of COVID-19 virus spreading through other regions as well. So we ask you to comply with the quarantine measures strictly, and they include wearing your face mask and washing your hands, and also having regular ventilation. And also it is very important that you take particular precautions if you visit indoor, closed and confined places. And as for those people who have not yet booked your COVID-19 vaccine, please do so. And we believe that you can do so by the 18th of September via our homepage if you are in the age bracket of 18 and 49. And you could also utilize the SNS platforms to also make reservations for your surplus vaccinations. And you can also make use of the surplus vaccines even if you have made your regular reservation for the COVID-19 vaccine. If you have not received your vaccine, please do so for the sake of safety of yourself and those of your loved ones. And once again, we would like to thank you for your participation.
지금부터 기자님들 질문에 답변 드리는 시간 갖겠습니다.
Right, that was Kim Gi-nam with Thursday's afternoon briefing, and I have Soa back here at the desk with a summary of his address, Soa.
Yes, Sunny. So with less than 2 weeks left until the Chuseok holidays, the official expressed concerns over the spread in cases, especially in the capital region, asking for people to continuously abide by social distancing measures and also encouraging those aged between 18 and 49 to make their reservations for vaccination if they haven't done so yet. And he also noted that the surplus vaccination program is also still continuing. Meanwhile, Meanwhile, the government, starting today, has expanded compensation for adverse responses stemming from vaccinations, and that includes some conditions specifically being monitored by the World Health Organization, such as myocarditis and Guillain-Barré syndrome conditions, and also the official stress that we are having more vaccines coming into the nation, including 873,000 Moderna doses that are to arrive here in the country today, this Thursday.
Right, well, that is good to know. All right, so thank you very much for that.
My pleasure.
Over in Europe, come Friday, that is tomorrow, Denmark will lift all remaining COVID-19 related restrictions. For more on this move and the reasons behind it, I have Professor Jens Lundgren at the University of Copenhagen live on the line. Professor, it's a pleasure to see you again.
Thank you very much for inviting me.
Right, so Professor, officials there have declared that COVID-19 is no longer a critical threat to society. Could we start with the meaning of these words?
So the meaning is that we have been quite successful in the rollout of vaccines, and as a consequence, do not consider the infection to be a major threat for public health. We obviously is struggling with the Delta variant. It's causing transmissions in society, in particular among those who is not yet vaccinated. But we no longer consider it to be something that can overwhelm the hospital system, and as a consequence, feel that we need to find a balance, you can say, between having society to work, but also contain the virus. And as a consequence, at the moment, I would stress, don't see the need to maintain restrictions.
Right. And Professor Lundgren, to what do you attribute this complete opening of all social activities?
Well, exclusively due to the fact that the vaccine rollout program in this country has been very successful. Many people in society have embraced the concept of being vaccinated, and as a consequence, our vaccine rates are very high, meaning that the mRNA vaccines, the Pfizer, Moderna, which we know are protecting in particular against serious disease, many people have received those vaccines, and as a consequence, the threat to for COVID, for the coronavirus to cause serious disease in society has been tremendously lowered.
Right, and according to media reports, we have around 80% of the population there above the age of 12 fully inoculated. Professor, is that accurate?
Correct.
Right. Now, does this lifting of prevention measures, Professor, also include the wearing of face masks within confined and crowded indoor settings?
Yes, I mean, it would still be recommended, but not enforced. So people should clearly see if they want to use face masks. But when I walk around Copenhagen, hardly anybody is wearing face masks at the moment, and not on open streets as you show here, but also in public transportation at the moment. I guess we're coming back to a pretty free society again, on all accounts.
Right. And Professor Lundgren, as a doctor yourself, what are your personal thoughts regarding the lifting of all prevention efforts, including the wearing of face masks?
Well, I mean, any restrictions in a country needs to be balanced and proportional to the threats from the infection to public health. And I guess the view at the moment is that, as mentioned, we don't have a major threat to society. That doesn't mean that we won't need to reinforce restrictions later on, should there be a problem with the durability of the vaccine protective response, or that the virus changes its genetic composition and can evade the protection from a vaccination. But at the moment, I think we are at a good spot. Again, restrictions need to be proportional to the threat. And at the moment, the threat is low. We do see people admitted to hospitals because of COVID, but most of those are explained by people who either have not yet been vaccinated or people who are suffering from severe immune deficiency, which we know don't really allow for the person, although they received the vaccine, to get the benefit from the vaccine. And therefore, those cases are well explained, and we're trying to handle them in different ways. But again, for society to work also during a pandemic, we need to make sure, at least in my opinion, that the restrictions and interventions are proportional to the threat. It is a dynamic process, I should mention and emphasize, and therefore, although it is true at the moment, and that's what the government had decided at the moment, that doesn't necessarily mean that when we enter into our winter season in a couple of months, that we won't need to reimpose some of those restrictions at that point in time, not only potentially because of COVID being more allowed to transmit more during the winter compared to the summer, but also because we haven't seen influenza in the last 2 years, and therefore the immunity in the population are pretty low, and so there is the potential for an influenza outbreak. And we already now see also RS virus as a cause of disease, in particular in very young ones and very old ones in society. So an open society, of course, allows for those viruses to circulate as well. So, but as a temporary assessment, I think we're in a good spot. But that doesn't mean we should lower our safeguards and be willing and able to re-implement restrictions if the situation worsens.
Right. And one very quick, brief question before I let you go, Professor. You mentioned the Delta variant earlier on. How are authorities planning to tackle the possible emergence of variants in the country, as well as deal with breakthrough infections?
Well, we are at the moment. First of all, we have a very good understanding of which virus is actually circulating in society, as all positive cases are genomically sequenced, so we know exactly which virus we're dealing with. The second measure is that we have started to introduce the third dose of the mRNA vaccine, starting with those who's most vulnerable and where we know that the response to the first 2 doses are lower than in the remaining part of society, and is seriously sort of considering as we speak of how that pace of third dosing should be done and which section of population should be offered that opportunity. So we try to sort of preempt any issue with losing immune protection from the vaccine by introducing the third dose in a rational and appropriate way.
Right. All right. Professor Lindgren, as always, thank you very much for your time and your thoughts.
Thank you very much.
특히 취약계층과 전통시장, 동네가게, 식당 등 소상공인 자영업자들에게 도움이 되고 민생과 지역경제 활성화에도 기여하길 바랍니다.
In our studio session on this Thursday, we assess the economic impact here in the country of the global resurgence fueled by the Delta variant. For more on this, I have Professor Song Soo-young from Chungang University. Welcome back, Professor Song.
Thank you for inviting me.
And I also have Professor Kim Se-wan from Ewha Women's University. It's good to see you again, Professor
Thank
Kim.
you for having me.
Right, Professor Song, we'll start with you then. Let's begin with the impact of the Delta variant on the global economy first.
Yeah, generally it could have a negative impact on the recovery of the world global economy, including most of the country has been affected, particularly among the advanced countries. So also Korea has suffered from some increase of some peoples who has caught coronavirus And also, Delta variant must have a negative impact on the world economy, and particularly for the U.S. and other advanced countries may have decided not to raise interest rate, and also because of the concern of the unemployment rate, and particularly for the industrial sector such as travel and leisure and those countries. But the problem is some asymmetric recovery of the world economy, and differing from in the various industries may have different paths. So that is really of concern, and so because of that temporary shortage of the supply could cause some inflation on some products. But on the other hand, there is a very lack of demand that will persist. So that is really a problem for the upcoming half of the 2021st.
Right. Professor Kim, Korea's economy marked a quick recovery pace, if I may, during the first 6 months of this year, that is before the start of the fourth wave. How has the local economy been weathering this particular fourth wave?
Korean government expects that the economy will grow over 4% for this year. And broadly speaking, it looks that Korean economy is on the track of growing 4% for this year as of September. In the first quarter, the growth rate was 1.6% on quarter, and in the second quarter, the growth was 0.8%. So that means if quarterly economic growth stays around 0.7% in third quarter and fourth quarter, then we will have over 4% annual economic growth in the end. But at the same time, economic uncertainty is growing due to a fourth wave pandemic. We are enforcing the toughest social distancing these days, and also raw material prices are rising very quickly. So these two factors are delaying consumption recovery, which covers about 60% of total GDP.
Right. And speaking about consumption, as part of efforts to fuel private spending, Professor Kim, the government is handing out another round of relief funds to members of the public. I believe each person is eligible for 250,000 won. What impact does this move look to have on the local economy?
Of course, government's cash out program of 11 trillion won supports the hardest hit by pandemic, like self-employers and young workers. And this is a necessary part to support these people to stay on economic activities. But it should be noted that the economic effect of the cash out program is not maximized due to Bank of Korea's interest rate hike in the last month. So it goes like that. For households, government puts 11 trillion won on households' pocket, but households from the same pocket, they have to pay additional 4.5 trillion won interest to the banks. So households are kind of confused to spend more or not. So that's the kind of situation for households.
Right. And Professor Song, as Professor Kim mentioned, the latest stimulus package is worth 11 trillion won. Now, do you see the spending perhaps as supporting the government's growth target of 4.2% for this year?
According to this report about its contribution to the economic growth rate has been estimated as 0.1% or 0.2%. And from the past experience in the disaster rescue money that is distributed to the people in the last year in 2020, it has a very similar effect is expected for this year's government rescue money to the people. So as Professor Kim mentioned, that then the people who receive those government support are supposed to pay the interest cost still, but it could have some positive effect on the consumption. So it could have some support to some mostly hardly hit people, self-employed, and some poor people. So to that regard, the effect, even though it is very not as big as, but still I believe the 4.2% growth rate is attainable and within reach. So because so far the government policy against to contain some spread of the coronavirus is, at least in comparison to other countries, clearly this is a success. And also economic activities are right now has not been much affected, particularly in the export, such as the semiconductor and the car industry. But the problem is, if the Delta variant effect has been persists in the other countries, in the U.S. and other countries, then the problem is very uncertain that it could have a negative impact and the slowdown of the recovery economy. Then it will mean a negative impact on our export. Then our economy may have begin to suffer from next year, early next year. So that is my expectation.
Right. So the long-term outlook for the Korean economy may not be that bright if the slowdown continues in other countries.
That's right. That is if.
Right.
If.
Professor Kim, some are concerned that the cash handouts will further push up consumer prices. What are your thoughts?
Yeah, I totally agree with you. Domestic inflation is getting momentum from early this year. The last month, August, inflation on year was 2.6%, which is highest in this year. So the over 2% inflation has been continued over 5 straight months from April, and this inflation is not actually controllable by government because it is partially generated by imported raw materials, and we can't have the economic power to control the oil price and so on. Given that situation of inflation, it is true that a government's cash out program stimulates inflation further because people spend more in the end. But I have to say that providing cash to the hardest hit people has the higher priority than stabilizing inflation under economic situation of today's economy.
Right, at this moment.
Right.
Professor Song, Korea's central bank recently raised its benchmark interest rate to 0.75%. Could you tell us a bit about the background behind this hike?
Yeah, I think there are two main reasons for the Central Bank of Korea has decided to raise the interest rate is from 0.5% to 0.75%. The main reason is the financial imbalances between such asset bubbles and because of the increased liquidity, because government has spent so much money and provided to the people. Therefore, then people, rather than spending those monies for the consumption, they would like to just make an investment in the assets such as stocks and real estate. So that may drive particularly the real estate price too much. So that is a concern. And another one is when I look at the data and from the December 2020, then where the increasing inflation rate, particularly for the consumer price index, had shown that above the 2%. So that is two primary reasons. But I believe this is currently the Bank of Korea does not have any mandate as to the unemployment and the gross GDP growth rate. Whereas the Federal Reserve has the mandate not only the inflation stabilization of the price, but also they have the reduction of the unemployment and leading to the full employment, and the GDP growth rate should be supported. So that makes the difference between the response to the current inflation, even though it is regarded among the economists that the current inflation is regarded as a temporary one because of the shortage of the certain area of industry. Good example is, for example, durable goods for the leisure and sports, a bicycle or in-house bicycle or such things are sold very much. But whereas the travel and the other types of leisure activities has been decreased too much. So that is why there is some kind of inflation effect due to the increased demand, and then lack of demand also causes deflation for some industry. That is the problem.
Right.
Mm-hmm.
And staying with that, Professor Kim, what looks to be the impact of this rate hike on the economy, generally speaking?
Well, interest rate has millions of different impacts on every corner of the economy. But let me just put the impact of the higher interest rate on housing market and household debt. It is true that high rising housing price is much affected by low interest rate and ample liquidity in the market. But at the same time, the real factor, the fundamental factor of that high housing price is generated by the shortages of houses and apartment. And we know that even though it goes well along with government's plan, it takes at least 3 to 5 years to construct the huge amount of apartment in the end. So I would say higher interest rate has partial control to stabilize housing market. And secondly, the household debt is really a risk factor of Korean economy as of now. But if Bank of Korea raises interest rate fast, by assumption, that decreases households' consumption and companies' investment at the same time. That could trigger another round of downturns of the Korean economy.
I see. And having said that, Professor Kim, what do you then should suggest to perhaps ease the economic repercussions of this hike?
Well, as we talked about, there should be something like a more detailed and microscopic support on the hardest hit by the pandemic, like self-employers and small business owners and young workers. Particularly, out of total labor force, self-employers covers 25%. So our labor market structure is very much focused on self-employers, which is very much different from other advanced countries' labor market structure. So we should pay careful attention on these people's economic pains and so on. Otherwise, these self-employers and small business can go to bankruptcies for a higher interest rate because of marginal business situation and more interest payments to the banks. That is another big risk, possible risk of the Korean economy.
Professor Sung, some observers say the central bank's monetary policy stance is at odds with the government's expansionary fiscal policy. What are your thoughts on this?
Basically, the IMF has make a report about the estimation of the government debt ratio, particularly Korean government debt ratio. That is going to be just less than a third of Japanese and just half of that for the US by the end of 2025. So it means that our government debt ratio is very low, and we don't have to worry about, and we don't have to make some over-response. But the problem is because the rapidly aging population in Korea and the world's lowest birth rate, also those factors could make in the long run, Korean economy's, particularly government's debt ratio could be a threat. But that is in the long run, so we don't have too much weight or too much concern over that long run. But as Professor Kim mentioned, that currently the hike of a further increase of the interest rate, according to some report, then we could maintain the 1.25% interest rate. But I think that is cause a serious problem to some mostly severely hard hit, self-employed and the poor people. So to that regard, I think a further increase is not necessary. That is going to be over-response, I believe. So to that, I think the one-time increase is okay, but otherwise we have to be careful, and we don't have to worry too much about the government debt ratio at all.
Right. And staying with what Professor Song has just said, Professor Kim, the general outlook is that the central bank will further raise its key interest rate. And if it does, when do you suppose this hike will take place?
That is a really tough question, Sunny. Actually, that is actually $1 million question the same time. But market's general expectation is Bank of Korea will increase the key interest rate by 0.25% either around the end of this year or early next year. That really depends on, the timing really depends on the economic situation of Korea. I would say if inflation goes up over 2.5% in September and October on an annual basis, then I would say Bank of Korea will try to increase the key interest rate by 0.25% in November. However, if Delta variant spreads out more and economic recovery is delayed significantly in the second half of this year, then Bank of Korea will delay interest rate hike until early next year.
So these are the elements to watch out for. And very briefly speaking, Professor Sung, more than 604 trillion won has been set aside for next year's budget. It's more than 8% larger than this year's. What are your thoughts on this aggressive spending plan?
Oh, that's acceptable and no problem, I think.
You support it?
Yeah, simply speaking, yeah.
All right, Professor, thank you very much for your thoughts. And Professor Kim, thank you very much for your insights today.
Thank you very much.
Thank you.
Right. Meanwhile, just like the uneven impact of the pandemic on countries worldwide, pundits say the pace of economic recovery is expected to be equally as divergent. Thank you for watching. See you on Friday.